Well, hey guys, just chugging along on my beauty dust here this morning, about ready to get finished getting dressed and getting ready for my day. I thought I would film a video today because I get many questions all the time. What is my skin type? Or can you help me determine what my skin type is? And by skin type, people are usually asking, am I more oily prone? Am I combination, sensitive, dry, mature? They put themselves into these categories. And patients ask this, you guys ask this in the comments. It's a very common topic that people are wanting to have some help with. I think it can be incredibly confusing, and I hope this video helps to elucidate a little bit about skin types and really what they mean to me as a dermatologist, and kind of hopefully help guide you in terms of choosing your skincare a little bit more wisely and practically. So skin types are, for the most part, generalized categories that are largely promoted by the cosmetic industry and marketing campaigns in an effort to package more or less many of the same products into different bottles with different colors on them, so that they can market to different demographics, okay? And I'm not discrediting the skin types entirely, okay? They can be helpful. Some people indeed are, in fact, prone, for example, to being very oily, okay? Some people, in particular those with a condition called seborrhea, have oily skin, okay? People with rosacea have dry, sensitive skin. That's part of their disease, okay? And so it's helpful when cosmetic companies market to those demographics, because they market their products that are going to be least likely to be problematic for those skin types. Taking a step back, as a dermatologist, skin type is not something that we are ever taught as far as the oily combination, sensitive. It's not part of our lexicon. It's not anything that we talk about in meetings. It's not in any textbook, medical journal. It's not something that we really study, okay? Instead, when we think of skin types, we actually are referring to something called the Fitzpatrick phototype, which helps in determining how an individual's skin is going to respond basically to light. So there are 6 Fitzpatrick phototypes. Type 1 is very, very pale skin, often red hair, pale skin, green or light blue eyes. Always is going to burn when they go out into the sun or when their skin is exposed to ultraviolet light. And these individuals rarely ever heal with post-inflammatory hyperpigmentation. They tend to be plagued more by redness and post-inflammatory erythema, okay? Whereas at the other end of the spectrum, Fitzpatrick phototype 6 are people who have very dark skin and never burn when they go out in the sun. They always tan, and when their skin becomes inflamed, it heals with post-inflammatory hyperpigmentation or a dark mark, okay? So that's kind of how we categorize skin types, and there is some ethnic variation built into that, but it's not necessarily one ethnicity is going to be one skin type, okay? We don't look at it that way. In fact, in order to determine the phototype, you actually have to ask the patient a little bit about how their skin responds to light. So, for example, you ask them, if you go out in the sun with no sunscreen on a sunny day, will you always burn? Will you usually burn? Will you sometimes burn, but you can tan? Those are the kind of questions that we ask, rather than assuming somebody is a certain phototype based on their ethnicity, okay? And it's very, very helpful. Dermatologists, we use a lot of light-based treatments, as I've talked about in many of my videos. We use lasers, not only for cosmetic reasons, but for medical reasons as well. And knowing how an individual's skin is going to respond to these light-based therapies is really, really important for determining adverse side effects, and selecting appropriate wavelengths that is going to be right for the patient. Okay, so when we say skin type, we are thinking about how your skin responds to ultraviolet light. We're not thinking anything about how your skin responds to makeup. It's not part of our lexicon, and it's not something that we talk about. So when patients come to us and patients come to our office and, you know, we're looking for skin cancer and they're like, what's my skin type? And we're like, well, do you burn? So it's kind of this discrepant conversation. The patient's looking at you like, what is she talking about? So kind of try and understand that for the most part, the skin type thing is largely promoted by the cosmetic industry. That being said, however, I'm not totally going to discredit it because I think it can be helpful in many, many ways, okay? The cosmetic industry targets different demographics who are prone to certain things like oiliness or sensitivity, and by labeling their products that way, they generally can get them to consumers who need them and would benefit from them the most, all right? In kind of plain language terms, okay? And kind of guiding people towards products that contain ingredients that could be helpful for their skin. You know, for example, you know, not everyone who has oily skin may necessarily understand that the ingredient salicylic acid or the ingredient lactic acid can kind of help to lightly exfoliate the skin and just kind of help with shininess, all right? They may not know that about that active ingredient, but seeing a product that says great for oily skin, they, you know, it makes it a little bit more straightforward for them. So I'm not entirely discrediting it altogether, and I think it can be somewhat helpful. But what I would encourage you is not to pigeonhole yourself into one of these categories. Our skin is very dynamic, okay? And it changes with environment, it changes with hormonal influences, it changes based on medications that you might be taking, it changes all of the time. So to call yourself one of these skin types, oily, combination, dry, sensitive, what have you, you know, you can really get locked in and go down a rabbit hole. But some questions that I can give you to ask yourself that hopefully will be helpful in helping to better understand how your skin responds to things and kind of how to best understand what's going on. First of all, you know, ask yourself this: how does my skin generally respond to skincare products? Does it respond with stinging? Does it respond with burning, redness? That's a telltale sign of sensitivity and or rosacea, okay? And so, you know, selecting products marketed towards sensitive skin is prudent in that situation. But do know that different things going on in your life may make you more sensitive to stinging and irritation. So kind of always be having this ongoing dialogue. And when that's going on, you know, take a step back and choose fewer products and products that are marketed for sensitive skin, free of fragrance. You can also ask yourself, does my skin tend to be on the dry side? People who tend to be on the dry side, for the most part, it's a very simple remedy in that, you know, you're not moisturizing properly or you're bathing too frequently, okay? So every time you rinse the skin and it comes in contact with water, as that water evaporates, it's going to dry out the skin further. So cutting down the frequency and really being cognizant of how often you're getting your face wet and actually washing it, whether it be with a gentle soap or a non-soap, just merely the act of putting water on your face can lend itself to dryness, okay? So really being aware of the fact that, hey, my face is always dry. Well, how often are you getting it wet and bathing, okay? That can be a real telltale sign, and maybe just taking a step back from that can be helpful to you. Also, people who may find their skin is dry, ask yourself, what environment do I live in? You know, really, really dry climates, particularly in the wintertime, particularly when the ambient humidity is quite low, it's inevitable you're going to experience some dryness, okay? Whereas somewhere like Houston, where I live, where it's incredibly humid, people complain that they have oily skin all the time. And, you know, part of that is simply the environment, okay? I've lived both now here in Houston as well as in Colorado, which is incredibly dry. And the skincare and my skincare routine was slightly different in Colorado than it is here. I needed a lot more moisturizers, a lot more of the Vanity cream and the CeraVe than I use and need now that I'm in a humid climate. Okay, so that's something to really be aware of. Then I think the other thing that you should also ask yourself is, does my skin tend to heal with a dark mark, okay, or post-inflammatory hyperpigmentation? I think that's really important to understand about yourself so that you take a proactive approach and avoid things that are going to be excessively irritating to your skin. I think when our skin heals with post-inflammatory hyperpigmentation, we have this idea that if we scrub or we peel or we keep going and we keep washing and cleansing, that somehow it's going to go away. And in fact, that actually makes the post-inflammatory hyperpigmentation persist longer and potentially worse. So if you're somebody who has acne, for example, and when it heals, you've got a dark spot there, know that about yourself. Be really vigilant about sun protection and back off on some of the aggressive products marketed towards exfoliating and peeling the skin and scrubs and harsh things like that. Okay, so that's a really important thing to understand about your skin that will differ a little bit from skin type to skin type, Fitzpatrick skin type to skin type. Then, you always want to take a step back and look at the bigger picture and ask yourself about your overall lifestyle. What is my lifestyle like these days? Stress does not make anything better, okay? And so people who are under a tremendous amount of stress, working really long hours, unhappy with their overall quality of life, it can definitely show on your skin. Your skin is an organ, and all of your organ systems are affected by stress. And your skin is the one that you will see with your eyes. The rest of them you won't, okay? So pay attention, when you're sleeping poorly, when you're not getting an adequate nourishment and adequate nutrition, relying on a lot of fast food and that kind of thing, not sleeping properly, just very, very exhausted all the time, it's going to start to show, okay? It's going to start to take its toll on your immune system, and your immune system and your skin are in cahoots, and they're gonna start laughing at you, okay, and giving you a hard time and saying, chill out, okay? And it may manifest as flaring of your acne. It may manifest as dryness, redness, irritation, a dull appearance, all of those things, because your skin is not adequately regenerating and repairing and healing and restoring at nighttime, okay? So really pay attention to your lifestyle factors. And then I already mentioned asking yourself about your climate, dry climate, humid climate. If you live somewhere with hard water can actually make acne worse. I don't have any great tips for dealing with hard water other than decrease the amount of bathing that you're doing, but it certainly can impact acne. There are some studies suggesting that perhaps hard water can influence some of the composition of the lipids in our oil glands and push more towards acne. So hard water can actually impact that. Also pay attention to the UV index in your environment. Here in Houston, as you hear me mention all the time, it's quite bright. The sun is out, and when it's out, it's quite bright, and it's reflecting off surfaces everywhere. Be aware of that, okay? Because if you are using products that peel the skin, if you're on medications that make you more sensitive to sunlight, pay attention to the UV index in your environment, because if you are on these things or in a situation where you're already at increased risk for sensitivity to UV, and you live in a climate where the UV index is high, those two things together can lend themselves to post-inflammatory hyperpigmentation, persistent redness, irritation. So be aware of that. And regardless of the UV index, you do need to wear sunscreen year-round, all day, every day. I get many questions on this. Everyone needs to be wearing sunscreen and reapplying it throughout the day, because it is a behavior. Cloudy days, you're still getting at least 80% of UV exposure. Clouds do not protect us. glass in the window in the cars does not protect us from UVA. And UVA is the component of light that doesn't necessarily burn you or lead to redness, a burn, but it does drive inflammation in the skin, post-inflammatory hyperpigmentation, and aging. So be really aware of the UV index in your environment, and just always be very, very conscientious of your sun protective behaviors. Then another thing to ask yourself is just to kind of globally evaluate your diet. I wouldn't go berserk and try and do like a food diary and pinpoint it to any particular food group or an elimination diet. That's generally not helpful. But foods that we do know that don't really help skin are, well, alcohol. I mean, it's not really a food, but alcohol unfortunately makes most skin problems a lot worse, just to be blunt, particularly rosacea. If you have rosacea, alcohol is not your friend, okay? Alcohol just causes flushing in the skin that leads to redness, and it can result in dryness, irritation. And depending on how much alcohol you consume, your body can really have to cope with the burden of that, and it manifests in your skin. So be aware of your alcohol intake. Alcohol consumption also influences our sleep cycle, and sleep. A good sleep, restorative sleep, is really, really important for skin health. So pay attention to that. Likewise, eating foods late at night can influence your sleep cycle and make it difficult for you to get restorative sleep. And then probably the food that gets the most, internet hype is dairy. And I will just emphasize that it's really, where the data lies is with skim milk consumption and acne, okay? And particularly it was teenage boys who have acne. Those teenage boys who consumed more skim milk were more likely to have difficulties clearing their acne than teenage boys with the same type of acne not consuming as much skim milk. But skim milk does seem to be a problem with acne, so I say that because, Starbucks is on every corner. People love those drinks. They're already laden with a lot of sugar, which sugar doesn't help skin problems either. Sugar and then the skim, if you're using skim milk in those drinks, that can really set you up for a flare of acne, oiliness, and worsening skin problems. Again, pay attention to how many showers a day that you take, how many times a day you wash your face, and consider cutting down on that if you're somebody who is predisposed to dryness, redness, patchy, dry, irritated skin. Your skin's just not looking great. Cut down on the frequency of bathing and allow your skin barrier to restore itself and to stay intact for a little while, and you may see some improvement there. And then the other thing to ask yourself is, well, have I been pregnant recently or started and or stopped birth control pills? Hormones definitely influence skin biology, oil production, and so stopping birth control pills or being pregnant and then delivering, lactation, all of these changes in the hormones can certainly influence skin. Likewise, during the menstrual cycle, acne is likely to flare, particularly hormonal acne in the jaw area. So just pay attention to those kinds of things. Also, can increase your sensitivity, lend itself to you having more problems with cosmetic stinging, a lot of face washes. Some people are like, today I woke up and I've been using this face wash and loving it, and today I just washed my face with it and it's burning. Why is that? Well, ask yourself some of these questions, and perhaps it can be helpful in elucidating that, as opposed to ruling out the skincare product. Also ask yourself about, also just think, am I taking any medications for any health problems? Blood pressure medications can influence our skin, as well as a variety of others. It's not any reason to go stopping them, but just be aware that could be contributing rather than a problem with the skincare product. It could just be that the medications that you need to be taking per your physician have side effects on your skin that are resulting in dryness, sensitivity, and redness. Then for whatever reason, people don't always equate the fact that the stuff they put in their hair touches their face and can influence their skin. So, do you use styling products, straight, gels, mousses, sprays, setting sprays, all of those things can really, they just settle on the skin of your face. First they go on the scalp and then they kind of trickle down onto your face. And they can really cause irritation, flares of acne, dry skin. They can really cause a lot of problems. They tend to be heavily fragranced, and particularly if you wear your hair down, the hair is touching the sides of your face. It can really cause a lot of problems on your skin. So be aware of the stuff that you're using in your hair and your hairstyles. Lastly, one thing that definitely can influence how your skin is behaving is the amount of times that you're touching your face. I think that particularly during stressful periods, it's very easy to inadvertently start touching and picking at our face without even really being necessarily aware of it. So being kind of conscientious of that behavior can help tell you a little bit about what could be contributing. When we pick the skin, our immune system goes, hey, stop doing that, and comes into the skin, creates an inflammatory rhinitis that can kick off a flare of acne, that can kick off a flare of itching, redness, irritation, and lend itself to post-inflammatory hyperpigmentation. It can be really, really hard for a lot of people. There's a lot of fervor and energy on the internet for all of these DIY extractions and blackhead stripping and all of these things. So there's really a lot fueling that fire and desire to pick. And I really, really would encourage you to just sit on your hands. During heightened periods of stress, the compulsion to pick at the skin can sometimes be a source of stress release. And, I would encourage you to try and find some other avenues to occupy your hands. They sell those like little squeezy things, squishy toys that some people find helpful to just squeeze, to kind of just get that same sort of release out. An adult coloring book can be helpful. Maybe just writing a letter or journaling, anything to occupy your hands and your mind and get it distracted from stress and the compulsion to pick. Get rid of those pore mirrors for sure. If you are undergoing a stressful period of time in your life, dealing with depression, anxiety, or just the day-to-day pressures and maybe somebody isn't being nice to you, and you're feeling very badly about yourself, I would really encourage you to talk to someone. I've mentioned this on here before, but I'm a fan of the BetterHelp app, wherein you can speak with an online counselor in the privacy of your own home from your phone or computer or tablet, what have you. I'll list it down below for you guys. I also made a video on why I like the app if you're interested. But if you're somebody who's struggling with the compulsion to pick at your face and it seems to be helping with your anxiety, I would encourage you to think about talking to somebody rather than allowing it to impact your skin health. And your overall health for sure. Do pay attention to some of these other influences in your day-to-day life that impact how your complexion looks. Skin, like I said, is very dynamic, so don't wedge yourself to one of these skin types and feel like you have to be married to a particular line of endless products. Less is always more when it comes to skincare. The fewer things that you put on your face, the happier your complexion is. The fewer things that touch your face, the fewer times you touch your face, it tends to be a lot happier, okay? It has less work to do because it has less to keep out, okay? So skincare focused on a plain fragrance-free moisturizer and a plain fragrance-free sunscreen that's broad spectrum. That's really all that you need, regardless of your age, regardless of if you're, quote, mature skin, if you're teenager. Those are really, overwhelmingly so. In general, those are the basic tenets of skincare. And the fewer things that you put on your face, the better off it is. Anyways, guys, I hope this video was helpful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget,